Why is a COVID booster dose crucial against the Omicron variant? We speak to public health medicine specialist Dr. Mohammad Farhan Rusli on why booster shots are our best defense right now.
So when we're talking about the vaccines, the first and two doses, so for Sinovac, we know that after 3 months, the neutralizing antibodies can drop down as low as 28%. And when you say low as 28%, you don't even talk about Omicron. You're talking about being reinfected with the current Delta, Beta, and all these other variants, which is already out. You talk about the Pfizer vaccines, it's almost about 6 to 9 months. So before you can even touch on whether you need booster doses to protect yourself from Omicron, you actually need booster doses to protect yourself from things that are already existing.
He opined that heterologous vaccination or mix and matching vaccines, especially one with a third mRNA dose, would boost protection towards symptomatic COVID-19, which would ease the burdens on healthcare systems.
So these vaccines have actually been proven to be one of the highest efficacious, even in real-world data, even though the numbers slightly differ, it is actually extensively quite high. And the reason being because the mRNA is very specific in its role, and you can see that it has tremendous amount of neutralizing antibodies once it's given into people. And boosting yourself with a shot of an mRNA vaccine after your first 2 doses of mRNA is actually quite good. But when you're talking about inactivated vaccines such as Sinovac, we know that boosting it with an mRNA vaccine as a booster increases it. But this does not mean that you cannot boost yourself with Sinovac. So you can get first dose Sinovac, second dose Sinovac, third dose Sinovac. But it would not be as high as if you got the first 2 Sinovac and the third one an mRNA vaccine.
Dr. Farhan also urged the people to trust in science and data. He reiterated the fact that benefits of a COVID-19 vaccine far outweighs its risks.
The real reason why we should be getting it is that the science has shown us that this is the way forward, that this is the best protection that we can actually receive. Let it be 6 months, let it be 9 months, or let it be 1 year. We do not know, but believe me, no country in the world wants to give vaccines to their people every 6 months or every 9 months because they are paying for it. Malaysia is paying for the vaccines as much as they can. They want to save the money, wouldn't it? So if they tell you that they're buying the vaccines and giving it to you, definitely it's because it's absolutely necessary.